If you have lower back pain here, just above your pelvis, it's normally a non-lower back problem. You may try everything like massage, stretching, foam rolling, but 99% of the time, the real cause of lower back pain is not the lower back problem at all. And today I'm going to show you 3 things. Number 1, how to relieve your lower back pain instantly. Number 2, why it keeps coming back. And number 3, the most importantly, how to remove the real cause once and for all permanently. Hey guys, my name is Gabby. I'm Olympic weightlifting coach and founder of body alignment training. For years, I worked with Olympians, national level athletes, and everyday people just like you dealing with structural pain. Today, I want to show you something most people overlook. Thanks to my colleague Leah, so she has left the lower back pain problem. You can find 2 bony line marks on your back. That's what we call the PSIS, as I show you here. Normally speaking, this one and this one 4 fingertip width. When I just located Leah's PSIS, interestingly, we find the left side is more away from her spine, the midline, right? The right side is closer. And the left side is where she feels the pain. Your lower body is into a what we call clockwise rotation pattern. I'll show you what's happening here. Look, if the pelvis is rotating like this, so your left side is under torsional compression. Okay, your pelvis is slightly twisted and the tissue around this area, they are holding that twist. So the tension here locks the structure in place. And once that happens, because it's so tight, it's restricting your pelvic motion like flexion and extension. And number 2, because it's locked, so it's restricting your lumbar vertebrae motion. So basically means your lower back gets stuck. Instead of stretching here, the real issue should be restoring the pelvis back to neutral position, right? Since your hip motion is locked, so when you lean forward, you can only stretch the muscle along your spine. And when you lean backward, because it's blocked, so it's the tension stuck at your SI joint. First of all, I want you to lie down on your side. Make sure lower body all in perfect 90 degree. If you're asleep as Leah, you can tuck a folded towel beneath your waist to keep your spine lengthened rather than up collapsing in the middle. And then find yourself a foam roller or a plucky ball here. Okay, voila, that's our set position. Firstly, I want you to exhale first. Bring the lower rib aligned with the pelvis. Okay, and inhale, create some intra-abdominal pressure. And then, when you're inhaling at the same time, push the upper femur backward. Okay, stay at your limit for 2 seconds. You're going to pay attention once you are leaning back from your lower back, lumbar spine. Don't do that. Get back. So the whole pelvic motion is from the SIJ, from here. Okay, and then you can exhale and recover and slightly push your femur forward. We're going to repeat it again. First, I want to exhale to bring your chest aligned with your pelvis. And inhale, bring the upper femur backward, create the space and the intra-pelvic motion. Stay at your limit for 2 seconds. And then when you exhale, relax and bring the femur back. I want you to repeat it for 10 reps and then stand up and test. Probably the pain is already gone by now. Now let's test again. Forward, backward. Now how do you feel?
Good.
Great. If you feel instant relief from that movement, congratulations. But if you go straight back to old daily postures, the pain will likely return. Instant relief works a bit like magic. It works for a moment, but when the clock strikes 12 at midnight, Cinderella has to go home. And when you return to your normal routine, the same structural stress returns with it. So instead of chasing temporary relief, probably we need to understand the root cause, right? Well, let's step back to first principles. There is one force that every one of us deals with every single day. Yes, that's gravity. Walking, standing, sitting, training, everything we do happens under gravity. The moment your body loses the ability to manage gravity on this earth, you die. So the real question is not why do we have pain? The real question is how well is your body managing gravity? When we were new babies, the bodies were relatively balanced. The structure is organized to manage gravity efficiently. But as life goes on, long hours of sitting every day, repetitive habits, uneven training like golf, badminton, right, that kind of thing, we begin to lean and tilt in different directions, sometimes forward, sometimes to one side of the body. Now here's the key principle. When your body leans both in sagittal plane and the frontal plane, something inevitable happens. A momentum arm is created, and once a momentum arm exists, rotation appears in transverse plane. So the sequence is always lean, momentum arm, rotation. And because the body exists in 3 dimensions, once this process starts, the system begins to spiral through the entire body. Once you understand this pattern, you begin to see it everywhere. Look down at your feet. One side always has bunion than the other. Look at your hands, your fingertips, they're never fully aligned. When you squat, you're always tilting to one side instead of go straight up. These are all signs of structural rotation moving through the body. Allow me to show you a real example. This X-ray is from a client who came in with lower back pain. Look, the rotation begins from the feet and travel through the shin, the femur, all the way to the pelvis, up through the body. Eventually, the wrist, the lumbar spine, around L4, L5, and SIJ. At that point, the structure can no longer rotate smoothly. So instead of rotating, it compresses. And when compression builds up there, he experienced a lower back pain, nerve irritation, and tingling down the leg. But notice something important here. The symptoms appear in lower back, yet the structural problem began from the ground up. Many rehab methods attempt to fix this with patch-like solutions, stretch here, massage there. However, these approaches often create a new compensation or a new momentum arm elsewhere in the system. The problem does not disappear. The compensation simply shifts to another region of the body. Like if you fix the lower back, actually you experience new shoulder pain or neck pain. The goal, therefore, is not to add more drills. The goal is to unwind the system and restore the body toward neutral alignment. To restore the system, 3 things must happen. No shortcuts. Step number 1, rebalance pressure. First, we need to regulate internal pressure in the body. Think about those inflated tube dancers outside shops. If the air pressure inside isn't regulated, the structure collapses and bends randomly. Your body works in a similar way. When breathing pressure is poorly regulated, the structure cannot stabilize itself against gravity. So the first step is restoring pressure control. This movement is called chest-pelvis alignment breathing training. I want you to lie on your back, make sure your lower back fully attached on the floor, and then bring both of your feet on the wall. Keep your hips, knees, and ankles all in 90 degrees. Most important thing is keep your second toes upward, point to the ceiling. And how to prevent your lower body from collapsing, you can squeeze a pillow or Pilates ball between your upper thigh to keep them aligned. So the key is not to squeeze your knees way too hard. That's going to also creating the collapsing. Okay, just keep your second toe, kneecap, and pelvis perfectly in alignment and get your spine fully rest on the floor. If you have way too tight lower back, what you do, you get the folded towel and tuck it beneath your pelvis. Voila, that's a perfect setup position. Okay, let's focus on the breathing part. First of all, look, that's our lower ribs. We call that coastal arch. So Leah's coastal arch is slightly protruding outward, right? So I want her to exhale first to bring her lower ribs aligned with the pelvis. So they're like 2 doors closing, right? And getting low towards the pelvis. That's what you should feel when you exhale. Let's do it again. Relax and do it again. Exhale. Feel ribs closing and down towards the pelvis. That's the first movement we do. And then I want you to pinch your nose and close your mouth, seal your mouth at the limit of exhalation. And then I want you to just inhale. Look, what's happening is like her belly sucked in. What's happening within her body is the diaphragm and the pelvic floor, they are both raising up. So the tension of them being released. Okay, relax. Very good. Let's do it again. So exhale first. Okay, when there is no air left here, I want you to seal your mouth and pinch your nose and inhale. So it can help you to release the tension of your internal organs and restore the elasticity of the twins, diaphragm and the pelvic floor. Okay, relax. Because it's demo, so the duration is holding a bit longer because I need to speak. But actually, you can only hold the inhalation. This is actually called the forced inhalation technique for 3 seconds. That's it. Just please, please, please pay attention. Exhale and inhale. Do not activate any muscles around your neck. Should we feel like upper chest fully relaxed, everything happening within your belly, nothing happening with your upper chest and the neck. Okay? Great. Exhale first. Align the chest with the pelvis. Pinch your nose, seal your mouth. We're going to do forced inhalation technique. Inhale. So diaphragm and pelvic floor, they'll be raised together and release the tension. Okay, just for 3 seconds. And when you inhale, just let it go. You don't need to think about where the air goes. Okay, and we can repeat that for 20 reps. Step number 2, realign the lower body. Next, we address the lower body. Remember why rotation began. A momentum arm was created, so instead of fighting rotation directly, the goal is to bring the momentum arm back to 0. When the momentum arm approaches 0, the body naturally derotates. Okay, so first you need to find yourself a yoga block, but that's sometimes a little bit wobble, so a thick book would be a good substitute to that. Okay, come here. So I want you to put your in longitudinal foot arch upon it. So basically your heel bone and the big toe ball firmly upon the book like that. Okay, very good. And then keep your hips, knees, and the second toe still aligned. And I want you to relax your spine first. Okay, just relax your lower back. Very good. And then bring your toes up. So shift your body weight forward and backward. Find your balance right in the middle, and then your balance will be shift to the midfoot, the high space of your foot arch. And can you shift your body weight left to right? What we are doing, we are bringing your body weight right to the middle. And then relax your hip groin, relax the back for the knees, relax your ankle. Focus on your lower body, okay? Maintain your balance in the middle, lower yourself down so you are sinking down until your ankles motion get blocked. Is that your bottom? Very good. So you don't need to squat low. When you're at the bottom, I want you to push the floor away through the big toe ball and the heel. Push slowly, slowly, very slowly raise yourself up. If you do it correctly, the upper body's ankle would be maintaining the same. So she is using her lower back as a fishing rod. Bring her back up. So let's do it another time and focus on the right movement, okay? So relax hip flexors. Very good. So you can use your fingertip, touch your hip groin. There should be literally no resistance. And also it happens to the back of the knees. There's too much tension, relax here. Very good. Keep your knees aligned, toes aligned. Balance, okay, you can only bring your balance between the heel and the big toe ball. Slowly get yourself down. Look. You are sinking down. As long as your ankles motion get blocked, push the floor away. Okay, relax your lower back. It's from the lower body. Push the floor away. That's it. And raise yourself up. I want to repeat this motion. Focus on the synchronization of the lower body joint. And repeat it for 10 reps. Step number 3, relearn daily patterns. Finally, we retrain everyday movement patterns because if you return to the same habits, rotation will simply come back. Learn how to sit, stand, and move correctly allows the body to maintain its alignment under gravity. So the most important thing is when it comes to the sitting or standing your daily life, because that's actually the position we stay for the most time of the day. Maybe we sit like 8 hours, 12 hours, even 14 hours a day. So what matters is the movement pattern here. So let's talk about the sitting first. When you sit, I prefer you to sit on a flat surface. That's because the floor, right, your feet, and your pelvic level, the head level, they create 3 parallel level to each other. So I don't really like the, fluffy, spongy kind of pad. I just prefer really flat chairs rather than the ergonomic ones. Okay. The second thing, if you can keep your ankle, knees, hips all in 90 degrees, that's going to be perfect. And number 3, because your lower back is going to sustain lots of pressure when you're working, the best way is you get some support in your lower back. Okay, get a cushion, get your lower back supported rather than they are working on their own. The most important thing is never ever rest your elbow. No matter if you are like typing or driving, that's gonna create the tension there, and that's gonna create the collapse and the body weight leaning towards that side. No amount of like correctional work gonna save you if you like work like that or sit drive like that like hours of day. So I want you to sit upright, let your shoulder resting on your scapula rather than resting on your arms like that. Okay, lower body all in 90 degrees. You better get your lower back supported, and voila, that's a good sitting position. And then when you are in a standing position, I don't want you to be slouchy like that, playing with your phone, right? Always standing on one side of the body. Do you still remember what do we do? Bring your toes slightly up because we're standing on the tripod rather than your toes. Forward and backward 50-50%, left, right 50-50. Okay, right in the middle, we are eliminating the momentum arm here. Okay, that's always just keep your balance in the middle. When you have a shoulder back, don't always let it rest on one side of the body. Keep on rotating left, right. So there is no chance you are always collapsing towards one side of the body. Just get yourself in the middle. I think in the long run, your daily movement pattern, standing, sitting postures are much more important than those corrective movements. Remember the PSIS test we looked at earlier? When the pelvis returns towards neutral alignment, the difference between those 2 points begins to reduce. And when the pelvis stops twisting, the lower back usually stops carrying the load. That's why solving the structure is far more powerful than simply treating the symptoms. Actually, these 3 movements come from my 28-day full body alignment protocol. If you want the full system, here is how it works. You join our next cohort. You commit to 1 15-minute structure reset per day and place a deposit. Complete the program exactly as prescribed. It's refunded. So finish it and it costs you nothing. If you're interested, check the link below. Guys, if this explanation helped you understanding your body differently, subscribe to the channel and share this with someone dealing with lower back pain. Human before athlete. This is Gabby. See you next time.